Mulago National Referral Hospital too pulled up their socks in boosting security for newborn babies. The hospital installed biometric doors and CCTV cameras on the labor ward 5C and postnatal ward 5B to curb baby theft. The mothers too started going through a string of security checkups on arrival for delivery and on discharge.
As these patients, as the mothers move out, we register them, we take their records. There is a security stamp that is put on their discharge form, because this will always reflect back. If you're saying maybe you passed and maybe your baby was taken away, but you signed and we even put a stamp to show that you passed through the right channel.
Makerere University researchers discovered that the much treasured 21st century communication channels, the mobile phones, carry deadly disease-causing pathogens. Markets and learning institutions were named as key carriers, circulating the deadliest of these pathogens, which are greatly resistant to antibiotics.
When I got these organisms from the mobile phones and I tested them in the lab, they showed that they are resistant. The drugs cannot work on these mobile phones to cure them in case someone had an infection from these small organisms. Thus, when you use these antibiotics, when you use these our Panadols and Septins to heal an infection that has been caused by these small organisms you found on the mobile phones, you will have done nothing because the organisms have become resistant.
Professor Richard KAMPALA, a prominent long-serving local and international physician, stood his ground and disagreed with all Ugandans seeking treatment abroad. He advised all jumping on the bandwagon of self-initiated referrals to divert the funds to ensuring their lives and those of their loved ones.
That's why you hear people advertising, a child needs an operation, you need 80 million. He needs 45 million. He's just going to be in a hospital for 3-4 days. If there was effort to get the necessary equipment, the skills to do those operations are here.
It has surely been a gloomy year for people living with the HIV virus, starting with researchers declaring CD4 count irrelevant in the fight against HIV, to drugs constantly getting out of stock, which has sent many to their creator. The following were major tickling issues under the HIV struggle. On 22nd September, Ugandan scientists led by Dr. Charles Chiyaga, the National Viral Load Coordinator from the Ministry of Health, declared CD4 count as irrelevant in treating AIDS and its related symptoms. Following guidelines from WHO, the doctors took up viral load monitoring, which may become a white elephant after people living with HIV confessing how there were insufficient centers for testing their viral load.
Viral load targets the virus. The virus is what challenges your body, the HIV virus. So when you're given treatment, the treatment targets to actually suppress that virus. So the viral load test is able to detect in terms of how many copies of the virus is circulating within your blood.
People living with the HIV virus may not enjoy the much celebrated festive season, as many battle with the after effects of ARV drugs stockouts. Over 823,050 people living with HIV are headed for a dark season after failing to get the life-saving dose of ARVs. On October 15, 2015, National Commodity Stock Status Report showed that 12 of 17 ARV regimens in the public sector have fewer than 3 months of stock remaining at the central warehouse, and 6 of these regiments have no stock at all remaining at central level.
So we are asking Ministry of Finance to release the money so that NMS can do the procurement. For Ministry of Health, this is Ministry of Health's mandate to provide treatment to all Ugandans, and we are asking them to act on their mandate.
The capital Kampala was in a panic for close to 4 months after typhoid claimed many lives downtown, plus the surrounding suburbs. It was early February when the Ministry of Health confirmed that typhoid had erupted in 4 divisions of Kampala, killing 2 people instantly. Although the ministry dispatched a team of surveillance experts, several people contracted the disease. Consequently, 2 people were confirmed to have died from the typhoid-causing bacteria. Fatuma Nelwanga for Urban TV.